Hi, everyone. Welcome back to another episode of Coffee Chats with Claire. I'm so delighted to welcome Dr. Sicong Li, a Harvard trained general dentist who leads Smiley Dental in Maryland. She started her own office in July 2024 after working in private practice for 4 years. She's also an active member of the American Dental Association and the Academy of General Dentistry. Thank you so much for joining us here today.
Thank you for having me.
Of course. Let's start off with your current roles and responsibilities. Can you please walk me through a typical day or week at your dentistry practice?
I'm currently the owner of my own business. So I am a small business. I have like two dental assistants. I'm open like 5 days a week. So every day I get in around like 9 and then I leave around 5. Every day I kind of see like a mixture of patients. They come and see me and it might be like a cleaning, it might be emergency exam, it might be like some like consultations for orthodontics or even like, problems they're having currently. So it's like a nice wide range every day that I see for like the patient, like in their scope.
What do you enjoy most about what you do?
I enjoy the most is kind of working in a team in my own office and also giving like a lot of like, I love educating my patients. I like taking them out of pain because usually no one likes coming to the dentist. So I think the best thing that I enjoy is basically them coming to me and being like, oh my gosh, like I really was not scared this time around. Like maybe going to the dentist isn't as scary. And oh, like maybe I never knew that this was what I had to do with my teeth. So that was something that like I find like really gratifying is being able to like teach people what I know and also just like working in a very like nice cohesive team and providing like the best care that we can for our patients.
Great. How do you see the field of dentistry evolving in the next 5 to 10 years?
Well, the field of dentistry is definitely always changing. I think like now with like AI and like all this technology, I think it's like a very exciting time to enter dentistry. I think back in the day when people think about like dentists or thinking about like, oh my gosh, like all these molds, like people like doing all these things making you gag, and it's just like, and it's like messy, it's goopy, it's so scary, and then it's just like, oh, I don't know how this will turn out, who knows? But now with like technology and like AI and stuff, like you can literally like plan everything out. It's like so seamless. We have like a digital scanner so you can scan people's mouths and being like, okay, so like what do you not like about your teeth? Or like, oh, like you want to do implants. Like, okay, like where should we place this implant? And just being able to plan everything out. And it basically helps eliminate any guesswork with like teeth. It's like, oh, what do you want your teeth to look like? Oh, like let's do like a digital mock-up of what your teeth will look like. And then being like, okay, this is what I like, this is what I don't like, without even having to touch your teeth. It used to be like, okay, let's just shave it down and then we'll see how it goes. You don't like it, too bad. It's like, So I think like dentistry is like very exciting in the fact that there's so much technology coming in. There's like all this new software. So I think like a lot of stuff like with 3D printing, 3D scanning is going to be like the whole future of dentistry, and it's just going to like take it to the next level. So it's really cool to be a part of it.
That is really cool. How
Yeah.
do you think that AI helps contribute? Does it help you organize things? What else does it do?
Yeah, so like a lot of stuff, it used to be like a lab is making like the shape of a crown. And I think with AI, it's really cool because it's like, okay, a person has like a missing front tooth, and usually you want it to look pretty similar to the other front tooth. You don't want one that's like longer than the other or like wider or narrower. So AI kind of helps like use like 3D imaging. And then you can even just be like, okay, I want exactly what this tooth looks like and just make a copy of it, which I think is like self-explanatory, right? But it's just like if you leave it to people to craft it, we always have like a different way of doing things. It depends on which lab you go to. But now with AI, it's just like so many things you can just like make things faster. So patients are getting their teeth in faster, they're getting all their stuff in faster. They don't have to wait like 3 weeks, 4 weeks for something random and it'd be lost in the mail. And they're like, oh my God, I gotta do it again. Come back, okay? And they're like, what the heck? What happened? And you're like, so FedEx, whatever. But now it's just like with AI, like a lot of things you can just design automatically without like someone having to literally like do stuff for you. So I think that's like literally streamlined so much of like dentistry.
Right, that's a lot more efficient.
Yeah.
let's backtrack back to where you originally started. So, where were you for high school, and when did you know that you would be going into dentistry?
I grew up in Missouri, so I went to a little small town in Missouri called Wentzville, and I was an avid band geek, loved band. I loved like socializing with people. It was so fun. I didn't realize I wanted to be a dentist until like when I was like 6, I immigrated from China, so I'm actually born in China. And then I went and lived in Japan for 4 years, came to America in the middle of Missouri, and then saw my very first dentist. And that's when I had my first experience with like even a dentist in general. And so he was basically telling my mom, like, oh, she has like 10 cavities. She needs to get 7 baby teeth taken out. So I got all of my baby teeth yanked out. But actually, like, you would think that this is like a really traumatizing situation. But actually, like, I was not traumatized at all. Like, they were so nice. Like, they were like, okay, like, this is how it's gonna go. Like, don't worry, like, step by step, like, distracted me. I don't even remember anything. It was just more like, oh, like, they took out a tooth. And I was like, this is so fun. Look at this tooth. So I was like, oh, like, going to the dentist isn't scary, but a lot of people do have like that trauma of being scared at the dentist because they're like, oh my gosh, like every time I go, something's hurting. Or so I was like, oh, like, honestly, like I've always had a very positive experience at a dentist. And then like going through like high school, college, I was like, oh, thinking about like what I want to do. And I was like, oh, you know what, dentistry might be like a really good thing for me because I like working with my hands, but I also like working and like interacting with people, and like dentistry is a very social, like a very very social like profession, but you're also like helping them get them out of pain, but also teaching them to like be like everything you do is like very like everything like I'm telling you is very preventable. So I think like dentistry is something that like as like a dentist I can like help others become better, but also like help treat them in like a very efficient way. And I like how in dentistry you can go into many different fields. I chose to go into private practice because I love like working in my own business and like growing like a reputation for myself and a legacy for myself, and also just like being able to control things versus like if you're in a hospital it's like kind of like a lot of hoops you have to jump through. You have like more of like different people that you gotta like consult before you can get to the root of problem. But in dentistry it was always like it's a small like operation, like people come in and I'm like, okay, great, this is what you need to do, this is what we're gonna do, like we're gonna get you in and out so that you're not like traumatized, but you enjoy your time with us and like continue to like do like preventative dental care. I think is like for me that was what I really wanted to like do. So yeah, so it was like everything that I did in high school kind of like influenced what I wanted to do in college, and that's kind of like the field I went into for dentistry.
So, did you focus on dentistry like when you were in college? And what
Yeah.
classes? What type of classes did you take?
Yeah, so dental school and medical school are the same kind of prerequisites. So it's basically all the sciences. It was basically very science heavy. I think one of the stuff that they do recommend but not require is like some kind of like arts and crafts, like working with your hands. Another thing is like jewelry making. People really like jewelry making or just like doing things just like art stuff. Like I think that's a combination of science and art. So I think like it's a very broad like it's a very broad range. Like, so I think like the classes that I took was just mostly medical, but it has or like science heavy, but it's also kind of like art as well.
That's so interesting. I never
Yeah.
thought about like jewelry making as something that could help. Cause I was in this jewelry club at my school. So like
Sure.
my friend brings the materials and then we make our own bracelets. So that's
Yeah.
interesting. Yeah.
No, it is like a lot of the tools that you use in jewelry making is going to be the same tools that you use in dentistry.
Oh wow.
Yeah, even like
Never
nail
thought about that.
art, like even nail stuff. So I was like, oh, okay, this is exactly
Oh,
the tools that we use.
yeah, that's so funny. Okay, I do my own nails too, so maybe I'd be a good dentist.
Exactly. Yeah, you could consider it.
um, how about dentistry school? What is it like, and what are some of the most challenging and rewarding moments?
Yeah, so dental school at Harvard was a little bit unique. Usually, dental school is just dental school with your dental school classmates. Our class was very small. It was like 36 people a year, so it was very selective and very tiny and petite. So the way Harvard's curriculum was like they want you to also understand like the body as a whole and also it's like oral health. So um not a lot of dental schools do that, but they also do teach like medical stuff, but they were like more medical heavy. So that's how I met like a lot of my medical school classmates and also learned a lot of general medicine and going through hospitals and all that stuff. And that's usually called didactics. It's just like science, science heavy stuff. Um, and then, so that was the first 2 years was just like schoolwork is a lot of preclinical stuff. And then the third and fourth year is all clinical. So that's when you actually go and see patients. That was a bit daunting, but I think for every dental student, it was very different. It was either like you're really good at just like doing the book work. But then once you get to like the clinical side, which is like all hand skills, then some people are like, oh, my hands aren't as good as this. So they needed more practice. Versus like for me, I was like more like, oh my gosh, like there's so much stuff to learn. And I was like so overwhelmed because I was like, oh my gosh, like there's so much stuff to learn that I was like not as great, like, or like not as like passionate about like the book stuff. But once I got to like my third and fourth year and like being able to actually treat my own patients was like so terrifying. And also just like, but because of that, like I learned a lot better because I was like, oh, I'm doing these for my patients and just being like, what can make their like, what makes them more comfortable. I think then that was how I really felt was very gratifying and being able to like know my first patient and they're like, oh, you did really great. And I was like, yay, thanks. Like, that's awesome. Or like doing their like first little like front crown. I was like, oh my gosh, like that tooth looks beautiful on you. Like, I was like, oh my God, it was made for you. And they're like, that's funny. And I was like, it's literally just one tooth. But I was like, oh my gosh, one tooth like literally changes everything. Like, oh my God, it looks so good. So I think that was like just having those patient interactions and them being like, oh my gosh, I have like a whole smile now. Like I had no teeth before. Now I have like a whole set of teeth. And I was like, yes, like it looks so good. Like, take it for a spin. Like it's so good. I love it. Like just like that was like the most gratifying and just like learning with my classmates. I thought that was like really gratifying too. So yeah.
That's awesome. Is there anything different, like looking back on the path that you took, is there anything different that you do?
Anything different that I would do? Honestly, I don't think so. I think there's some things in which I was like, oh, like I wish I didn't make that mistake or I didn't do this. But I think in the end, like whatever mistakes you made, it just makes you stronger and you just have to learn from those and make sure that you just try not to do it again. So I would say like I don't really have any like regrets or anything that would change my path. It's more just like, oh, I wish I like didn't do this or I was wish I learned this a little bit more. But like in the end, it's like you learn and then you also learn what you don't know and then just kind of like try to strengthen that as you go. So I would say like, if you're young and you're like, oh, I made a mistake, like don't beat yourself up for it. Like it's okay eventually. Like you will learn and nothing is that serious. Like that's why I like dentistry because like you're not gonna kill somebody. If you do, that's like really bad. That's like something else. But dentistry is like, oh, okay, like you didn't like the shape of your tooth. Oh, or like, oh, this is like I can fix that. Like that's okay. So it's never like too serious. Like
Right, right, right.
yeah.
How did you find the shift from practicing or studying for like tests and learning things to like hands-on experience? Like how was the transition there for you?
Yeah, so the transition is kind of crazy because like first you're learning everything through a book, so it's like kind of like, oh, it's okay if I don't know this, but then like once you get to a patient, you're like, oh, that was actually really important to know because now this is like a real life human and I could like, like do something that would cause them to not like me or like not like the like treatment. But we had like a lot of practice in preclinical. So it's these like very giant typodonts. It's literally like a no face kind of thing. It's like a giant mouth and you have to practice. It's like crazy. It's very scary. It's like a mannequin with like a bunch of teeth and you're just like you have to practice everything before you do a real person. So you have to like do those practicals and just like, make sure you do it well, and then they'll measure, like the instructors will literally measure everything. Like, okay, like now you know how to do this. Like now you can do it on a real person. You're like, okay, great. So like you do this enough to where you're like, okay, I can do this on someone that doesn't move, but now you have to do it on someone that does move is like kind of, so it's like it takes a really, really, really long time. Which is why in the dental school, I was like, oh my gosh, the patients are so nice. But they also get like very discounted like dental work done, which is like definitely supposed to be the case because we're doing like stuff that should take like 10 minutes, but at the dental school it takes like 2 hours. So just imagine like your dental appointments just being like 4 hours long sometimes and being like, oh, what do we do? Yeah, we just did one tooth. Like, oh my God. So it does get a little like it's pretty intense, but I would say like it was very, it's a very good learning experience, but it's just like the transition is kind of, it's just stressful, but at the end
Yeah.
of the day, you just forget about it.
Yeah, it's great that there's like simulations or like pre things that you can practice on. Like in my anatomy class, we were learning about hearts and stuff, and my teacher actually brought like cow hearts, which was really cool.
Yeah.
But yeah, yeah, but that's cool. Um, yeah, so let's move on to some advice. What advice would you give someone in high school who is interested in pursuing a career in healthcare in general or dentistry?
Yeah. I would say like someone who's in high school who wants to go into it, I would be like, wow, like that's like, are you sure you don't want to do anything else? Like, I would probably say like this. I'd be like, okay, like you really gotta make sure because once you're in, you're in. Um, because like I would say like high school is still like really early. Even in college, you would be like, okay, like first 2 years, like as long as you have your science courses, you're still qualified for dentistry. I think right now with dentistry, like dental school, it's very expensive tuition. So I would say like that's a huge thing that like high school students should probably consider, like maybe like look at like scholarships, but also like making sure you really want to do dentistry because it is an investment. Like I think it's still a great field to go into, but I think there are also a lot of other fields that you could also go into. Just don't think just dentistry, but if you really want to go into dentistry, shadow other general dentists, look at like the different specialties. I'm a general dentist, so that means like I can do like a lot of stuff within the dental fields. Like I could do like extractions, I could do like implants, I could do orthodontics, like I could do root canals, fillings, crowns, whatever. Um, but not all general dentists do that. General just means like, oh, you can do generally everything, but you don't have to do everything. Specialists are the one that kind of go past dental school, and it's going to be more education. It's going to be like 4 years of dental school. It's like 4 years of college, 4 years of dental school, then another 3 years of residency. If you want to be an oral surgeon and do dentistry, you would go through dentistry and medicine. So you're going to go through dental school, then you go through medical school. That's 7 years. So it's like a lot of time commitment. So some people are kind of like, oh, I don't really want to do that long of school. Then I would be like, okay, dentistry is not for you because it would take a really long time to become a dentist. Or if you want to specialize, that would be additionally more years. But it's kind of like medical school too, where it's like residency after medical school. Um, but I would say like think about like if you truly love like working with your hands, make sure you're really physically fit because people, dentists, like I think dentistry, you also have a lot of physical labor to it because like you're kind of like, okay, these tongues are really strong. Okay, like people don't think that, but you're kind of like, oh my God, like I'm wrestling these like mouths, and you're like, I need to be strong because I was like, I got back pain sometimes just like from like, oh my God, these people, because it gets so stiff, and you're like, oh. So yeah, so like make sure that you're physically capable, and you think that like if you think you're strong, keep working out, okay? Like you're still young, just keep everything maintained. That's my 2 cents. But if you still want to go into it, I think it's a great field to go into.
I have a quick question. Is there a particular reason why that you wanted to be like a general dentist instead of going more into like oral or specialized?
Yeah, so a lot of my classmates went into specialties. I chose to go into general just because like I was like, oh, like I'm gonna go to dental school and I'm gonna see all these patients, and then now let me see if there's anything that um, I'm really passionate about. And then I realized like I was like, I kind of like everything. So I was like, oh, like there's root canals where you just do root canals all day. It's like very microscopic, very precise. And I was like, yes, I do like that, but I also like being like, oh, like, like maybe the next patient is just like an Invisalign thing. And I'm like, great. I love doing like straightening teeth and they really love it. And the next one's like, oh, some fillings. Okay, let me just do some fillings, like blah, blah, whatever. And then people are like, oh, I want like veneers. I'm like, okay, great. Let's go do that. Like, it's just like the variety of general dentistry is like for me, I'm just like very ADHD, so I'm always like boom, boom, like I want to jump back and forth. So like I'm always like, yes, like this is the next patient, this is the next patient, going, move on. Like I like the fast pace and makes like things like it's just like a wild, it's just not like it's just like a wide case selection. So it's always like something's thrown at me and I'm like, great, like want to do that. I can do that. I can do that. Um, but like specialties are also great in the fact that you don't have to predict anything. You're like, okay, great. Like this is what I do, and I like doing it. So that's why. So I went to general just because I like everything basically.
And it's like it's like exciting too. You like never know what's gonna come at you.
Yeah, you're like, oh wow, like that's crazy, and then I'm like, okay, let's do it. So it's a good time.
Is there anything else that you'd like to share with our audience, or any final thoughts that you'd like to leave us with?
Well, final thoughts is that, yeah, general dentistry or like just dentistry in general is a great field to go into. And I think it's never too early to start thinking about career options. I also think there are a lot of other career options out there. But I just think like for me, like I love the fact that I get to run my own office, see the patients that I want to see, and that patients enjoy seeing me. And I think at the end of the day, it is very like gratifying to be able to like treat patients and have them like you back. But other times it is a little bit stressful, but that's like with everything. So I don't think that there is like one like perfect profession for everyone. It just finds like what is works well for you. Yeah.
In closing, thank you so much for taking the time to share your experience and your advice, Dr. Sicong. The work you do in dentistry and the advice that you give is truly, truly valuable. And to our listeners, thank you for joining us on another episode of Coffee Chats with Claire. See you all soon.